coverage. But before we talk about some of the specifics I'd like to cover and go over that we've talked about throughout the year, I mean, we've got to talk about what we just talked about with Tara. I mean, that is a confusing conversation that we just tried to have. You saw one person who was able to finally make it happen. How much of a problem are these deadlines and these moving deadlines to getting insurance, to getting coverage?
I think it's been a rocky start to this part of Obamacare. One of the things I want to point out is, we can probably get into this, is Obamacare is bigger than just the marketplaces. But the first months of October and November were tough. But I think some of that is getting better now in December because they fixed the federal government website, and in Missouri is going through the federal government healthcare.gov. So a lot of that confusion with moving deadlines was because of the problems they had on the website.
Well, I think there's still, though, issues with the moving deadlines because, when the president will get on TV and say, we're doing this, and this is what we're doing, and this is what's going to happen, but it's not always that that's what's going to happen. It's maybe that's what could happen, and it can be up to the insurance companies as well as if they're going to allow for some of those extensions. For example, when he moved the deadline to December 23rd, well, that was fine, except for the insurers who were selling off of the marketplace. Many of them decided they wanted to keep that December 15th deadline. So we were then scrambling at the last minute trying to get people enrolled who were enrolling off of the marketplace before the December 15th deadline. So there's certainly a lot of confusion on the deadlines.
This is is this partnership working between the law and the private companies, the private insurers?
Well, it's an interesting partnership. I mean, certainly the plans have changed quite a bit. If you thought insurance was complicated before, just wait until you see these new plans. I mean, the way that they've had to structure them to make them comply with those metal levels, because the bands that they have to fit into are so narrow that they've had to do some really interesting things to make the plans be bronze, silver, gold. I mean, there have been some issues with that. And just getting everybody enrolled and through the system, the communication between healthcare.gov and the insurance companies is not ideal. I've put a number of people through healthcare.gov, and I am not showing on the other end as their broker or agent who helped them at all with one single one of them. So it's not ideal.
Remind us why we want everyone to be insured. What is the bargain that was struck here with insurance companies in this law? And what is the benefit?
Well, from a community standpoint, the benefit is huge. You want your population to have access to healthcare services, and that benefits everybody. Despite all the political rancor that you hear about this, Democrats will very much want this because they feel that the idea of the pursuit of life, liberty, and happiness, healthcare is intrinsic in that, and that you really can't do that without healthcare, and healthcare should be a fundamental right for everybody. Republicans, on the other hand, still want the same thing, but for a different reason. A healthy population is a productive population. It's not a dependent population. It's people who are working, creating things. They have jobs, they pay taxes, they own things, that kind of thing. So you want a healthy population. It benefits everybody. But how that exactly is done is usually the sticking point. And just in that relationship you just mentioned with the insurance companies and the government, the changes themselves start to become problematic. For instance, just tonight they announced that because people have lost some insurance and then now they can't get it back, the folks that were canceled when they had previous policies. Well, so they just announced tonight, okay, we're gonna count those people as catastrophic healthcare eligible. So now you can get, if you're in that position, you lost your plan, you can't get another plan, now we'll consider you catastrophic. So under the law, now you can go apply for a catastrophic plan, whereas previously they weren't allowed to do that. But we're sitting here on December 19th, and that's a very short notice to do that. So I think that relationship's being strained just because of all the changes.
Right, and there's some issues too with that, and that the catastrophic plans, they're not really that much different than the bronze plans just because of that out-of-pocket cap that has to be on all of the plans. But a lot of the people that are losing coverage in Missouri are losing coverage out of the high-risk pool, and these people have got some chronic conditions going on, some major health issues, maybe they take some expensive medications, and so a plan where they might have to come up with the first $6,300 before anything kicks in, may not be a viable solution for them.
People with chronic issues are losing coverage, because I thought this was a situation where these were young, healthy people who were paying the very minimum, and those policies were no longer good for the equation.
The state high-risk pool is closing December 31st, and so you have a lot of people who've been paying into that program for many years who are losing their coverage.
And the plan was always that they would come into the marketplaces or go onto Medicaid coverage. And because of the rocky start of Obamacare's website, that has been rough. But getting back to your original question about what's the stake here, I think, Doug had it quite right, that I think the other point I would make is that we all pay for this. We all have a stake in this. And so if you're paying insurance and you've had insurance forever, you've been paying for part of the cost of the uninsured. And so now we're going to pay for it in a different way. So I think that's really important, and estimates are that it's a few $100 to $1,000 per family plan. The other point is the providers have been carrying a lot of the burden of this for many years through charitable care, through uncompensated care, and we're now hopefully going to be able to ease that burden a bit and pay for it in a different way.
This, the risk and this responsibility has already been socialized to
Right.
some degree.
But in a different way that's very haphazard and very inequitable, and hopefully this will straighten that out. I know it's going to be rocky for a year or so, but
Yeah, and don't forget the payments that, for instance, Medicare makes to hospitals have been cut several times in the
Right.
last several years, with the bargain that we're going to, we the government are going to pay you, the hospital, less, but you're going to now have less charitable care because everybody's going to have insurance who comes to your facility. So that deal only works if the back end happens, if people really do have insurance coverage and they're able to get health care that's, it lowers the total burden of the charity care.
And they expected that people would have Medicaid coverage as well.
Yeah.
right, about half the people that were supposed to get insurance nationwide were supposed to go on Medicaid before the Supreme Court decision.
So the Supreme Court said what, and how did that ripple out into this, where
So
we are now?
the Supreme Court said it was voluntary decision on the state's part. Originally in the law it says it was mandatory that you had to expand Medicaid. So after the Supreme Court decision, states could decide to opt in or opt out. And about half the states chose not to expand Medicaid, including Missouri. So that leaves, we have about 800,000 uninsured in the state, and the estimates are that about 250 to 300,000 would have been covered if we had expanded Medicaid.
I think you are going to see a big uptick, though, in children's going through Missouri Health Net, because a lot of the people who are applying who qualify for the big tax credits through healthcare.gov are finding that mom and dad might be eligible for the subsidy, but the kids come back as a Missouri Health Net determination. So maybe a family that's paying for insurance for everybody right now is now going to be in a different situation next year, where maybe the parents will be on an insurance policy with a subsidy and the children will be through Missouri Health Net.
Ironically, we've seen nationwide that about 2/3 of the people that are getting coverage are going on Medicaid. And a lot of these people were they were eligible already, but they may not have known it. So they come to the system and they say, should I get coverage? And they said, well, you're already eligible, let's sign you up. So oddly, in states that aren't expanding Medicaid, we're going to have a Medicaid expansion. It's already 6,000 in Missouri.
Any
So-
chance that we will expand Medicaid as the law had intended 2014?
We certainly hope so. I mean, we need to remember that when the Accountable Care Act was passed, it was passed in a very rigid way, in the sense that they never thought that Medicaid expansion would be optional. So with that now being off the table in states like Missouri, there are people who don't qualify for federal help but aren't really qualifying for Medicaid either, and are kind of caught in that gap. And that can be very troublesome for folks that find themselves kind of in no man's land there.
So since the end of the legislative session, our Missouri legislature in both the House and the Senate had interim committees to look at this issue of should we expand Medicaid. And there's now a proposal out of the House led by Representative Barnes, and a proposal out of the interim committee of the Senate. They're very different. And the House proposal does have a Medicaid expansion, and it does have what they're calling Medicaid transformation. So I think if anything comes out of our legislature, it's going to be called transformation, a reform of Medicaid, maybe the expansion. The Senate is probably where the resistance is going to lie.
Lastly, here on Twitter, the people are saying they're kind of sick of hearing about that broken website. Is that going to be something we remember this time next year? Will it all be an afterthought?
Great question. I look back at the expansion of Medicare Part D, which is the prescription drug coverage, and I was involved in research projects on that. In the first few months were a nightmare. Pharmacists were complaining, people couldn't understand the website. I look back, and for 3 weeks they shut that website down. Mark McClellan in the George Bush administration went out to do a demonstration, and the website crashed. And so they had to wait for a month to get it started. And yet now you try to take that program away from the elderly, they go crazy.
Well, yeah, but a lot of them aren't buying it through the website. I mean, a lot of the seniors that I talk to,
Maybe,
when they
right.
sign up for Medicare Part D, they're either working with a Medicare agent
Right.
that's helping them with a paper application, or they're calling 1-800-Medicare and enrolling over the phone. But I would say the vast majority of them are not going online.
And that's an
enrolling in Part
important
D.
lesson we need to learn. Sorry, I didn't mean to interrupt, but it's like there are many ways that people should get help. And it doesn't have to always go through the website. There are brokers like this, there are counselors, even your physicians,
And
they can help.